Hi, today we're going to be working on our continued series on cervical rotation, cervical adjustments, cervical findings. And today we're going to be specifically focusing on cervical rotations. This is Dr. Travis Mason. He's a chiropractor and a napropath, and I'm Dr. Tony Zahner. So continuing on with our series, we're going to try to find out how to take rotations in the neck, proper rotation findings. We saw that earlier. You probably watched the supine. If you haven't watched, you need to watch it. How to take findings in the supine position, which is much easier because the body is laying down and it's in repose. So for now, when we want to take our cervical findings, we want to do the 1, 2, 3, 7, 6, 5, 4 pattern again. We're going to use our number 6. We're going to place our hand on the anterior portion of the transverse process tubercle. We're going to place our hand on there, and then we're going to go ahead and turn the neck into that position just to feel where the tension is. So what I'm feeling here right now is that I'm feeling tension going to the posterior. You verify that, Dr. Mason?
Mm-hmm.
Okay. So I'm going to go to 7 now. 6, 5, 4. Okay. So we'll turn it a little bit so you guys can see that a little bit better. Again, number 6, place it on the anterior tubercle, transverse process. We're going to take 2, 3. So 7, I have to go down, I have to dip. Again, I use a modified 7 when so think about an easy way to remember is C7 modified 7 in your hand. Remember from your napathic technique, these are the different contact points in the hand. So we're going to go 7, 6, 5, 4. Now to make it a little easier on the patient, you can include a towel. So Dr. Mason will tell you that it just gives you a little more feeling of ease. And also the patient has a little bit of a space in between you, so you've got some kind of a space there. All right, so now we're going to take the findings. We found out that going this way, there's a little bit of tension. Let's go this way now. So we're going to go the opposite way. We're on the posterior tubercle, and I'm feeling a lot more tension there. You agree, Dr. Mason?
Mm-hmm, definitely.
Yeah, so it was a lot easier compared to this. I like to do the way going from the anterior to the posterior. I like to do that first because that's usually not so tense. So then it gives me a nice reference. All right, so we determined that most of his vertebrae, so if we look here, and we'll take it to the side so maybe you guys know, it's this way. So his vertebrae are rotated posteriorly. So what we want to do is we want to get those vertebrae to go anteriorly. So I'm going to put my hand right there on the posterior tubercle, include a towel. I'm going to cinch up a little bit, then I'm going to rotate him. Now if the patient has to be seated, if they're sitting in a chair, ask them to put their feet flat on the floor to give you some kind of resistance. So there's 2, and here's 3. Now, if I'm going to do 7, I want to do modified 7 again. I'm going to scoop in, we get on his bare skin, posterior tubercle. We're trying to keep the rotation of his body a lot less and do more rotation in the neck. All right, so when you get done, you want to test as always propathy. So I'm going to test his lateral findings. They're feeling pretty good. And then we'll test his rotational findings. So we're going to go anterior to posterior. That feels pretty good. Let's go posterior to anterior. That feels a lot better, doesn't it, Dr. Mason?
Mm-hmm.
Yeah. So again, use of a towel gives a little bit of barrier. I call professional barrier or pro barrier, and it just helps the patient feel more comfortable. Okay, that's the rotational treatment for seated cervicals.